So we have often seen that children who are ill or not well often miss school, and because of which they lag behind in studies. I think the most important thing for a child is to be taught certain basic hygiene, which is basic hand wash, which is the most important thing. Whenever a child visits a toilet, there should be adequate and clean facilities for the child to go to the washroom or to the toilets. It is often seen that if the toilet facilities are not good, the children do not visit the toilet, and that is another reason why they can get infections like typically urinary infections, which are seen in young girls. Hand washing should be encouraged in school. That the children should be made aware to wash their hands before every meal, because often they are playing in the gardens, playing in the grounds, and their hands can have lots of germs. As far as parents and teachers, I think both are responsible for teaching hygiene. Hygiene has to be taught at home and hygiene has to be taught in school. At home, the parents should be encouraged to supervise that the children wash their hands before meals, that the child has a bath or a shower every day before they leave for school, or sometimes even after they come back from school, because they have played and they can be dirty. Children should be made aware to wash their face at least twice a day, because often we see that children have dirt which can lead to eye infections, ear infections, and upper throat infections. As far as giving guidelines about nutritious food, we know that children who have got iron deficiency, anemia, have got attention span disorders or deficits. So quite often we have seen, and we know with the latest study done by ICMR, that almost 70% of adolescent girls are anemic by the WHO standards. This could be because of improper nutrition, and this is not only seen in the poor or in the rural, but it is also seen in the rich and the urban classes. In the poor and the rural, it is because of certain myths that are associated and certain foods are not given to children. And in the rich and the urban, it is because of lifestyle, the junk food that is available, which is basically empty calories, which lacks iron, which lacks good proteins. So a proteinaceous diet, it could be vegetarian, it could be non-vegetarian, but a diet which is rich in proteins, because the children are growing, they need proteins to build up their muscles. They need iron, because if they are iron deficient, they can be less energetic. We also know their attention spans are less, and this can cause problems in their education.